Hello! In this health sketch, we want to talk to you about CPR, which stands for Cardiopulmonary Resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC.
First, look around carefully to make sure the area is safe for yourself and others before approaching. Introduce yourself to the victim or to the family member of the person. My name is Marilu, a trained first aider. May I help? Check for response by tapping the shoulder firmly. Hello, hello, are you okay? Hello, hello, are you okay? If there is no response, call medical assistance or AMO. State your name, location, what happened, age of the victim, etc. If your phone is not available, shout for help. Hey miss, in a red shirt, please call 911. Check ABC. Check the airway if there is any foreign object visible by doing head tilt, chin left method. Using baby hook, your pointing finger, or forceps, pointing finger with your thumb to remove possible obstruction. If the obstruction is caused by vomit, blood, or fluid, you may use a deep cloth or a gauze pad and use baby hook technique. Check for breathing. Look, listen, and feel for sign of normal breathing. Look for normal chest movements. Listen for normal breathing sound and try to feel the breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, but there is a sign of pulse, then get ready for rescue breathing. However, if the pulse is negative and breathing is negative, then you will need to start CPR. Do rescue breathing, 30 compressions, and 5 cycles. First, you're gonna find your hand position. Center of the sternum, 1 inches from the umbilicus area. Use your dominant hand over your non-dominant hand. The deep compression is 2 inches or 5 centimeters. Use the heel of your hand. Push hard and fast to the count of 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9. 1 cycle. Then give rescue breathing by pinching the nose. Then give 2 blows, hoping to see the chest rises at least 6 to 8 seconds in one breath. Remember, if you've been trained, you can give 2 rescue breaths after every 30 chest compressions, as this helps provide some oxygen. However, if you are not being trained or are not comfortable, just keep going with hands-only continuous chest compression. If there's still no sign of breathing, continue CPR till paramedics takes over from you, or if the person is definitely breathing again. Then, you'll need to check the airway, head tilt, chin left, and check the airway for 10 seconds. The patient is alive, so you need to check the dots. Dots, 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 dots. The dots is clear. Once the person is responsive, put him in a recovery position.
first thing you do is you need to check the danger, the location, survey the scene if it is safety. Then introduce yourself to the victim or to the mother or to the bystander. The next is check the responsiveness of the person by tapping the shoulder enough to wake him or her. If you notice upon your first assessment that the person has no pulse and it's not breathing, immediately ask a specific bystander or to the family member to call ambulance or AMA. Check the way if there is any foreign object visible by doing maximum head tilt and chin length. If you have an obstruction, do this technique. You can use BB hook using your pointing to remove the possible obstruction. Forceps using your pointing finger and thumb. Scissors using your pointing and middle finger. If your obstruction is caused by vomit, blood, or any fluids, you may use clean cloth, wrap it to your pointing finger, and use the baby hook again. After you're removing the obstruction to the airway, you can now proceed to check breathing and circulation, and you can check also the victim nose, mouth, and also by looking to the abdomen, chest area, and circulation by looking for carotid pulse located on the neck area. Check the ABC, airway, breathing, circulation, look, listen, and feel in 10 seconds. The victim has negative breathing, negative pulse, then give CPR. Give CPR 30 compression to rescue breathing in 5 cycles. Give to rescue breathing. Give to rescue breathing. Pinch, release. And another one. Pinch, blow, and release. Then check again the ABC, airway, breathing, circulation, the nose, mouth, and also by looking to the abdomen and chest area, and circulation by looking for carotid pulse. Look, listen, and feel in 10 seconds. Okay, the victim has negative breathing, positive pulse, so we need to give rescue breathing, 24 rescue breathing for the child. Do this for 24 blows rescue breathing, or until the person showing signs of life, positive signs of pulse and breathing. Always look at the face of the victim to monitor if he or she is making a reaction. So the victim has positive pulse and positive breathing. So next is the recovery position. Take their other arm and fold it so the back of their hand rests on the cheek closest to you and hold it in place. Use your free hand to bend the person's knee. Carefully roll the person onto your side by pulling on the bent knee. Rub the back to make the person more relaxed or vomiting stay with the person, and monitor their condition until help arrives. Also check the joints, deformity, open bone, tenderness, and swelling if there is any possible injury. And take note, you need also to get the vital sign of the person.
Good morning, everyone. Today, I am going to show what to do when a person is choking. First, ask the individual if they are choking. Encourage the victim to cough as they may be able to remove the obstruction. If the victim cannot speak or cough, usually they will signal that they are choking. Immediately perform first aid. Support the upper body by leaning it forward. Use your hands and your heels. Give 5 sharp back blows between the shoulder blades. Check them out if the obstruction has been removed. If not, perform 5 abdominal thrusts. Stand behind the victim and wrap your hands around them. Link your hands between the belly button and the button of your chest. Position your hand in a clenched fist beneath their chest. Pull sharply inwards and upwards. Repeat the procedure 5 times, then check the mouth for obstruction. There is other way if ever victim is oversized and you cannot wrap your 2 arms to perform abdominal thrust. Find a table, assist the patient to lean and bend the knee so that the victim's abdominal is on the edge of the table. Then give 5 back blows. If the obstruction still remains, call for medical help so an expert can take over.
Three persons carry for unconscious patient. This technique is for lifting a patient into a bed or stretcher or for transporting to short distances. Unconscious patient. First, cross the patient's legs. Second, the rescuers will kneel beside the patient. Third, prepare hands to insert beneath the patient's body. And then left the patients and rest in your dominant knee. Fourth, all the rescuers will stand and will start out walk at the same foot, walking in a line abreast.
3 hours later.
Hala! 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 Ang tao! Ang tao! Ang tao! Tabakin ninyo! Tabakin ninyo!
2-man assist. For conscious victim, this carry allows the victim to swing their legs using the rescuers as a pair of crutch.
I want it, but baby, at least I'm honest. I get tired of explaining as these seasons keep on changing. Life goes on and 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 on. Yeah, 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 yeah. On and 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 on. Yeah, yeah.
Sinya, bayar kerja sinya.
Oh no! Oh no! Oh no, 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 no! Oh no! Oh no! Oh no, 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 no!
Step 1. Bring the injured person to a safer place. If you don't have any bandage, you can improvise by using triangular cloth or scarf, like this one. It is okay to use 1 or 2 triangular bandage. Step 2. Fold the triangular bandage like this. It is like making a cravat. Step 3. After folding, put the first folded triangular bandage on the head in a vertical way, and then the other folded triangular bandage will be wrapped around the eyes to cover it. Also, tie it using square knot. And don't forget to apply pressure on the injured part.
Hide the excess end of the folded triangular bandage underneath so that it will look clean and neat. Step 4. Since this person only injured his left eye, we can use the other bandage to lift the blindfold that cover his right eye so that he can use it. And then, you will tie it using the square knot tie. The excess end of the bandage, hide it underneath so that it will look clean and neat.
Open wound. Open wounds are injuries that involve a break in the skin and leave the internal tissue exposed. It's important to clean a wound before applying plaster or dressing. This will reduce the risk of infection and encourage the healing process. Before anything else, it is important to gather all the materials needed to save time and effort. These are the following materials needed: cotton, alcohol, betadine, gloves, gauze pad, medical tape, medical scissor, and medical forceps. Wash your hands thoroughly with warm, soapy water. This helps avoid infection. Dry them thoroughly. If soap and water is not available, you may wear a surgical gloves. Wash the wound with water. Keeping the wound under running tap water will reduce the risk of infection. And don't use hydrogen peroxide or iodine, which can be irritating. Dry the wound with a clean cloth. With the use of cotton balls, apply a small amount of betadine to the wound. From the inner portion of the wound to the outer portion in a circular motion. Betadine rapidly kills bacteria commonly responsible for wound and skin infections. Lastly, cover the wound. Apply a bandage, rolled gauze or gauze held in place with paper tape. Covering the wound keeps it clean and to avoid infections. Just a friendly reminder, see a doctor if you see signs of infection on the skin or near the wound, such as redness, increasing pain, drainage, worm, or swelling.